Let's talk about the pelvic hug. I'm Dr. Nichelle Gurley and I'm specialized in prenatal and postnatal movement. The pelvic hug is something that I created when I learned long ago that so many of my prenatal patients had discomforts transitioning in bed at night, going from sit to stand, or other transitions in movement. So what I thought about is what's going on? Well, we're in that position for a period of time, even if it's only 30 seconds, and everything's relaxing in that position. We have the loosening of our joints. And so when we go to move, our body isn't quite ready for it and we get this sharp pain, or it's what causes us to be like, oh, to get out. So what you're going to do is you're going to use your own muscles to help stabilize your pelvis before you transition. So I'm going to show a transition from sit to stand, but this will work for rolling over in bed or any other transition. So what you're going to do is the biggest part is your glutes engaging. So I want you to squeeze your butt. What can also help is engaging your pelvic floor and lifting your lower belly. Some people only need to squeeze their butt, squeeze their glutes, and that's enough. If you don't know how to engage your pelvic floor or your lower abdominal wall when you're pregnant, then this is something that you can watch my deep core activations during pregnancy video to understand more of that engagement pattern. So what I'm going to do here is I'm going to elevate my pelvic floor with the cues that I know, lift my lower belly, squeeze my glutes, and then stand. Something else to think about with discomfort from sit to stand is that we don't want to push out like that. We want to be able to engage those glutes so we stand up. We're not pushing and leaning out of the chair because that's going to exacerbate things as well. So again, before we transition, we engage the glutes, we lift pelvic floor, we lift lower belly, and then we move. If we're in bed at night laying, same thing. It's like I'm about to move, pelvic floor, lower belly, glutes, other side. This is something you can do when you're getting in and out of the car. The pelvic hug is going to be more likely used by people who have pubic symphysis dysfunction or SI pain during pregnancy, just because they are the ones who need a little bit more of that support with that pelvic stabilization. Another option, if that's not quite working, is what I call to prime your butt, which means that before you get up, you're going to squeeze, squeeze, squeeze your butt, and then you're going to squeeze and hold, lift pelvic floor, lift lower belly, and then move. So some people might need a little bit of extra of a primer. So again, this is called the pelvic hug. This is you using your muscles to hold on to that pelvis, hold it together as you transition into a new movement. And a lot of times that'll decrease that pain quite significantly when you're doing transition of movement.